Hello, this is Luis, live from the EASD 2020, the Association's 56th annual meeting. This is the first fully virtual EASD annual meeting. Karagianis presented findings from a study examining bidirectional association between type 2 diabetes and obstructive sleep apnea. They concluded that the presence of obstructive sleep apnea at baseline is associated with increased risk for developing type 2 diabetes, while presence of type 2 diabetes is associated with increased risk for developing obstructive sleep apnea. Thus, effective management of either condition could prevent development of the other. Wolf presented a study examining acute effects of dapagliflozin on hepatic, lipid, and glucose metabolism in humans. They found that the rise of endogenous glucose production following SGLT2 inhibition is mainly due to increased gluconeogenesis, but not due to accelerated glycogen breakdown. Also, hepatic glycogenolysis, lipid content, and mitochondrial activity are not affected by dapagliflozin. Rosenstock presented the findings of the study that evaluated the use of once-weekly basal insulin, icodec. Insulin icodec showed similar glucose-lowering effects and safety profile as that of once-daily insulin clargine. It was shown that insulin icodec has the potential to improve treatment acceptance and facilitate T2DM management in patients needing basal insulin. Fadini presented a trial that aimed to compare the efficacy of SGLT2 inhibitors and GLP-1 receptor agonists in terms of their cardiovascular outcomes in type 2 diabetes patients. The results of this observational real-world data showed SGLT2 inhibitors may have an advantage over GLP-1 receptor agonists in improving cardiovascular outcomes of type 2 diabetes patients. Oten presented a study investigating the effects of insulin resistance and beta cell function at the time of diagnosis of type 2 diabetes on mortality outcomes and diabetes complications. They concluded that insulin resistance was an independent risk factor for total mortality, and management of diabetes should focus not only on normalizing blood glucose levels, but also reducing insulin resistance. Ranchagora presented a study investigating prevalence and BMI of early-onset adult type 2 diabetes in a multi-ethnic population. They concluded early-onset type 2 diabetes disproportionately affects South Asians and African Caribbean ethnicities. It is twice as high in South Asians and 10% higher in African Caribbean ethnicities compared to the whites. In all ethnicities studied, mean BMI in early-onset type 2 diabetics is significantly higher than older-onset type 2 diabetics. Darren presented the result of Virtus CV trial, which proved that ertugliflozin was able to achieve its primary endpoint of non-inferiority for major adverse cardiovascular events, or MACE, compared with placebo in patients with T2DM and established ASCVD, demonstrating the CV safety of ertugliflozin. Bohr presented findings from the DCCT EDIC trial, which investigated whether control of hyperglycemia to near normal levels reduces the microvascular complications of type 1 diabetes. The study proved that early intensive diabetes therapy significantly reduced all conventional diabetes complications. These effects were extended beyond the actual treatment period and were durable for at least 18 years. Strain presented findings from a study that investigated the effects of liraglutide and semaglutide on stroke and its subtypes, based on pooled data from LEADER, SUSTAIN-6, and PIONEER-6. This study suggested that treatment with GLP-1 analog reduced the risk of stroke in patients with type 2 diabetes and high cardiovascular risk. Davies presented findings from a study which tested the hypothesis The compensatory change in appetite and appetite-related hormones can explain the less than expected weight loss with SGLT2 inhibitors. The study validated that empagliflozin does not incite apparent compensatory appetite or appetite-related hormone responses in patients with excess adiposity and type 2 diabetes. It further underlined that there is a need for additional studies to explore the effects of SGLT2 inhibitors on hedonic drivers of eating behavior. With this, we conclude our 4 days coverage of the virtual EASD conference. Thank you for staying with us and have a good day.